Maintaining the ALC patient.
Objective. As a team, we would like to implement a program that will help improve the status of ALC patients to ensure the transition from inpatient to outpatient is maintained through effective daily activities.
Our mission is to implement interprofessional collaboration at Northford to provide daily programs for ALC patients to maintain and improve their quality of life. Our vision is to provide activities that are designed to maintain ALC patients' current health, prevent deterioration, and promote wellness. Background. Every day, approximately 7,500 or 14% of acute care hospital beds are used inappropriately in Canada. This is an apparent problem occurring for many hospitals across Canada due to the inability to properly care for alternative level of care patients. Once patients are labeled as an ALC patient, they no longer require the intensity or specialization of medical care provided from acute hospitals. ALC patients affect acute care setting bed occupancy, thus as a result impact staffing and care quality to these patients. From Canadian statistics, there is a reported 2/3 of ALC patients waiting for transfer to another healthcare facility. 11% die in hospital waiting for discharge, 44% waiting for placement to long-term care home, 28% are waiting for home care, and 13% are waiting rehabilitation. Some patients are waiting extensive periods of time to be discharged, which results in a deterioration of their health. Acute care settings are not equipped to meet the patient's restorative, supportive, or rehabilitative needs, which has been shown to place the patient at significant risk of deterioration, hospital-related infections, falls, and other adverse events. Northforth Health Center is having difficulty dealing with ALC patients. To aid the Northforth Health Center to decrease ALC patients, our team has put together a charter proposing an idea of how to implement recommendation number 4. The fourth recommendation is to provide in-hospital activation or exercise program to maintain optimal functionality and mental wellness while in hospital and continue program while waiting for alternative level of care placement. As a team, we have identified that there is great concern with patients losing their independence, social skills, cognitive function, and may digress instead of progress. The purpose of our project is to implement activation and exercise programs daily on the units to help maintain ALC patients' level of functioning by stimulating these patients. Our program will provide creative and stimulating activities for patients to participate in daily with an inviting environment. We would like to have different programs running 5 days a week between Monday to Friday, which will include social activities, exercise programs, arts and crafts, stimulating games, and activities of daily living. We have done a literature review of the benefits of these activities, which can be seen in our charter. Our findings indicate that these activities increase the health of patients. Social activities encourages older adults to socialize, which can increase their mood. Often older adults isolate themselves, so we would like to propose that our program will decrease isolative habits. Exercise programs will have to maintain their physical health and prevent further deterioration. Degeneration of muscle mass and strength occurs in older adults. Our program will help to prevent this. Art therapy allows for the ALC patients to express themselves through their art. Sometimes they may not verbalize how they are feeling, but art can help them express it in a way that is less intrusive. Stimulating games encourages the adults to use problem-solving skills, communication, patience, which can help to maintain cognitive functioning. Activities of daily living are important to self-identify. They are daily tasks that are performed by an individual. By providing a program that supports ALC patients in ADL tasks will help to improve their independence.
Goals and objectives. Our first goal is to prevent deterioration of mental health. The objectives are to include mental functioning activities once weekly, provide mentally stimulating activities, incorporate cognitive exercises, and to maintain mental health for discharge dates. Our second goal is to prevent deterioration of physical health, and the objectives are to include physical activities weekly, to encourage ambulation on the unit, promote less time spent in bed, and promote independence attending ADL, and maintaining physical health for discharge dates. Our third goal is to ensure that healthcare staff are supportive of the program. The objectives are to educate on benefits of the program, educate on schedule of the program, incorporate into plan of care in collaboration with the healthcare team, have a program facilitator attend morning rounds to inform staff daily about the program. Our fourth goal is to promote participation and interest in the program. The objectives are to promote the program by providing schedules to ALC patients, inform ALC patients about specific interventions that will benefit them, ensure education about the program is provided to all Northwest healthcare professionals to be aware of, and to also have them recommend the patients to attend, and also to check schedule of the program to make sure it does not conflict with other hospital activities. Our fifth goal is to modify programs regularly. The objectives are to create programs that are accessible to most physical and mental capacities, establish variety in program planning, create a monthly cycle of activities, and to incorporate patient suggestions to modify programs to cater to their wants and needs as well.
Our program is aimed to benefit the ALC patients' health outcomes. We will utilize a variety of healthcare professionals to implement daily programs to keep ALC patients active. This will ensure that upon discharge, these patients will be released and not have to stay in the acute care settings due to deterioration while awaiting long-term care. Our program will increase the patient's quality of life by providing innovative, fun, and strengthening activities. In art therapy, it will help patients release stress, allow for self-expression, distraction from illness, and promote calmness. Art can allow healthcare providers to properly assess and build a therapeutic relationship with their patients. Exercise will help prevent and strengthen muscle degeneration while ALC patients are waiting for long-term care home. It promotes independence and improves quality of life. In social activities, by reintegrating social hobbies and entertainment, there will be a reduction of social isolation and improvement communication, cognitive functioning, and confidence. In game therapy, patients are able to take part in enjoyable gaming which include fun, motivation, and challenge. Games will enhance cognition, motor control, emotions, social interactions, and communication. With ADL maintenance, activities that help patients maintain ability to perform ADLs will improve independence, self-identity, physical strength, and mental health.
There are benefits to both the Northward Hospital as well as the community. In successfully implementing this project, the hospital cost will reduce in the amount spent in ALC patients. This in turn will result in more funding for the hospital if the percentage of ALC patients decrease. This will also allow for more effective management and care and greater therapeutic outcomes for those patients who are not ALC, as it will allow the staff to spend more time on those who require the care on the unit, not the ALC patients who require maintenance as they wait to be transferred elsewhere. This in turn will reduce the amount of stress in the unit staff since their workload and responsibilities will be lessened, which will allow for them to gain a more effective therapeutic relationship. Lastly, there will be an increase in the number of available beds in departments appropriate for a patient's needs. This will also benefit the Northward community since more hospital beds will be readily available for those who are ill. Our program involves the community, hospital, staff working at the hospital, family members, and the ALC patient themselves.
So how will we do it? Our project approach utilizes collaboration with the interprofessional team. In order to ensure we facilitate this collaboration, we have reviewed and will implement the interprofessional competencies to ensure the best care possible throughout our program for the ALC patient. To establish effective team communication, each member must actively listen to other members, communicate to ensure common understanding of care decisions, develop trusting relationships with team members and clients, and lastly, use effective communication technologies. When team conflict is present, the team facilitator will book a team meeting to discuss the issue. Feelings will be discussed and the team will come to a consensus to solve the issue. The goal is to build on conflict to produce a strong team and program. Within collaborative leadership, the program facilitator is responsible for assisting, maintaining efficiency, collaboration, and goal-directed team members. For patient-centered care, we are aiming to create activities that will aid ALC patients in maintaining their level of function so they are ready to be discharged from the hospital as soon as a bed is open for them in long-term care. It is important to have the support and interest of clients, as well as their feedback of our program. For role clarification, each member involved incorporates their judgment and skills based on their scope of practice. The team members need to respect each other's scope of practice. Within team functioning, a team goes through 5 stages of functioning: forming, storming, norming, performing, and adjourning. Good team functioning can ultimately increase the client's health and quality of care. Our team has collaborated with the Northward Center head office and healthcare professionals. We have discussed the specific professionals to take 1 hour of each week out of their schedule to run their specific activities. Thus, we would not have to pay the professional for the program as they will already be working their routine shift. As a team, we would need to purchase specific tools for the use in the activities. Our charter has more detail about specific prices, and an estimate cost would be $12,576.85.
Here is an outline of our program.
For our success indicators, a researcher is required to record attendance and participation. This will give a good indication of the patient's interest in the activities patients are more willing to do and are more able to participate in. During the sessions, the researcher will keep detailed records of individual patients' abilities in participating and successfully completing activities. This will allow the researcher to track their progress throughout each session, comparing recent results to ones in prior sessions. As a more effective way of tracking each patient's progress, the facilitator will work collaboratively in staff rounds, updating other members of the healthcare team in their progressive physical and cognitive abilities, and receiving feedback so they may incorporate changes to meet the needs of the patients, promoting a quicker recovery. The most effective way of tracking their progress and the effectiveness of the therapy sessions is by receiving verbal feedback from the patients. The researcher will ask a series of questions including how much they enjoyed the activity, if they thought it was challenging enough or too challenging, what activities they feel they would benefit from more, and if they feel an improvement in their overall health from participating in the activities. We will be able to recognize when we have met the project's goals through the following. There is a reduction in the ALC percentage at the Northford Clinic, the average length of stay of an ALC patient is reduced, and when the patient's physical and cognitive functioning has improved. For us to be successful in implementing our charter, certain things must be in place. The staff at Northford plays a significant role in the outcome of our project. We need team members to be willing to make this change and implement our charter. First is management, so we are able to get the funds to begin our project. Healthcare staff involved must be willing to work as a collaborative team to organize the activities that support ALC patients. Open communication is vital for keeping this collaboration between all staff. Patient-centered care is our main priority as our program aims to maintain the quality of life an ALC patient has while awaiting discharge.